A lot of people get their medical advice from social media. And obviously you're listening to me today on social media, but you have to look who you're talking to. Hi, I'm Nikki Rodriguez, MD. I'm a board certified family physician and I've been practicing for over a decade. And so I've seen a lot of cases of the flu. I've treated a lot of cases of the flu and I've actually administered, I would say, thousands of vaccines at this point. So it's difficult for me to understand why a lot of people would get their advice otherwise. But with the access to media now, it's so easy just to scroll on to somebody who's claiming they may be a doctor of some sort, and they're saying otherwise that you may not need it. So it's important to look at the credentials of where you're getting your medical advice from and know that big institutions like Norman Regional Hospital and other hospitals have their own statements about it. Always talk to your doctor about it. They're always going to be willing to. Your provider, your nurse practitioner, your physician assistant is more than accessible to talk about this. How do they formulate it? It was very interesting how they formulate it. They look at the circulating cases of influenza A and B, and this is a trivalent vaccine, most of them are, and they get those prominent cases. They end up making the vaccine from that, and that's why we do see it being highly effective in many years. The ages to get the flu are 6 months and over. So your little baby is eligible to get it at 6 months. The groups you got to really hone in on are obviously 6 months to 2 years, because especially if they have a history of asthma or reactive airway disease, their lungs may not be fully developed and they're more susceptible to getting a pneumonia from the flu. And we also look at the ages of 55, 65 and older, especially when you get into your later geriatric years, because immunity tends to decrease. Then you're not as healthy. You may have diabetes or hypertension. So these can compound when you get the flu to be a much worse case. So we have to be an advocate for talking to our parents and our grandparents to get it. Maybe go together as a group. That's how we do it in our family. We go together because I know my little ones, some of them like that I give them a treat afterwards with the flu vaccine, but some of them are afraid to get it. And then once they see their older brother and sister get it, or they see grandma get it, then they feel more comfortable getting it. So one of the special groups to get vaccinated is the pregnant population. They have a lower immune system when they're pregnant, and so the severity of the flu can be devastating, requiring hospitalization and even fatality. So it's very important that when you're pregnant to get the flu vaccine. It is normal to sometimes get a little reaction after. That isn't the flu. That's one of the myths. One of the myths is that you will get the flu from the flu shot. That can't happen. You can get maybe a little bit of a temperature, a little body aches, and a tiny fever, which will last about a couple of days at most, usually about 12 hours. If you get the flu vaccine and you actually, say you got it on a Monday and you test positive on a Friday, the likelihood is that since there's so much flu going around, you probably just caught it because you're going to catch it anyways. It wasn't from that vaccine. A lot of people think that I don't need to get the flu vaccine because I'm not out in the public that much. I'm not a healthcare provider, or I don't work in the nursing home, but it is important to get it. One reason is that you're contagious, meaning you could spread it before the onset of the symptoms. So you're contagious most 24 hours before the symptoms start. So when you go out into public, say you go into the grocery store, you could actually catch the flu there with somebody around you that looks perfectly fine, because the symptoms are not there before you have the onset of the flu, meaning that you're contagious, but you do not have the symptoms. And then the symptoms come on the day after you left the grocery store. So you're thinking in your head, wow, I was out at church, I was out at the grocery store, I went out with my best friend and I exposed them. People should get their flu shot immediately. You're eligible to get it right now, but we're going to try to let you know that October is the most important month to get it done, because in November and December, that's when we see the most cases of the influenza, or we call the flu. You can obtain your flu vaccine at local pharmacies. You could also get it from your family physician's office. I want to thank everybody for watching, and I really appreciate it.